Welcome to the deep dive. Today, we're digging into something maybe not always top of mind. Healthcare's environmental impact.
Yeah, it's huge.
Huge. You think about all the waste, the emissions.
Mm.
It's significant. And it raises this ethical question, doesn't it? How do we balance personal health with planetary health?
It's a real tension, and often the focus is on big policy changes, hospitals, government action.
All right, the systemic stuff.
Exactly. But today we're zooming right into the consultation room, actually. We're looking at a really interesting 2025 interview study from the Netherlands.
Okay.
And it asks, what do patients think? Do they actually want to engage with sustainability when it comes to their own healthcare decisions?
So moving beyond policy to the personal level, that's fascinating. So, okay, first things first. Are patients even, on board with the idea that healthcare should be sustainable?
Absolutely. The data's pretty clear on that. There was a big Dutch national survey in 2024, over 9,300 patients.
Wow, that's a lot.
Yeah. And it found 69% thought sustainability in healthcare was important. And get this, 73% said they were willing to factor it into decisions.
Okay, so they're willing, but I sense a but coming.
Well, yeah, there's a nuance. While they're willing, they mostly feel the real responsibility, the main driver for change should be the hospitals, the government.
So systemic change first.
Yeah.
Makes sense. Less pressure on the individual making choices, perhaps.
Sort of, yeah. They see the bigger levers being pulled elsewhere. Individual choice matters, but maybe less than the system getting its act together.
Right. So if they want the system to be greener, are they open to hearing about the environmental side of things themselves, like getting information?
Generally, yes. Quite open, actually. A lot of them felt that knowing this stuff could raise awareness, maybe even influence their actions outside the clinic.
Interesting. Like ripple effects.
Exactly. One person in the study just said knowing information is always good. Simple as that. It points to wanting transparency, maybe feeling empowered by knowing.
Okay, that's positive. But I can imagine situations where that conversation would feel really out of place. Did the study touch on context?
Oh, definitely, and very clearly. Emergencies, absolutely not the time.
Right, definitely not.
One patient put it very bluntly, when someone is in an emergency condition, I don't personally want a doctor to come and start talking about climate change.
Can't argue with that.
No. But for non-urgent things, elective care, managing chronic conditions, that's different. Patients seemed much more open then.
Okay, so timing is crucial. What about how the information is given? Does that matter?
It does, yeah, whether it's, a direct conversation, something on a website, a leaflet. The delivery method can actually influence how they feel about their provider, often positively, surprisingly.
So getting the communication right is key. Now, let's say there is a sustainable option available in one of those non-urgent settings. How involved do patients want to be in choosing it?
Well, that's where things really split. There wasn't one single answer. Some people wanted all the details. Full participation, give me the data, especially if it's, say, an elective treatment. And the outcomes are pretty similar anyway. They want to make the call.
Right, the empowered patient model.
Exactly. But then you had others who were more like, look, if the clinical effectiveness is the same, I trust my doctor or the system to just pick the sustainable option for me.
Interesting. You're the expert. Just handle sustainably if it's safe.
Pretty much. One person literally said, I expect my healthcare provider to make that choice. So, it really shows providers need to be flexible. There's no single script here.
Definitely not one size fits all. Okay, but here's the big one. What happens when there's a conflict? When sustainability might mean a trade-off, even a small one, what wins?
Yeah, no ambiguity there. Individual health wins, overwhelmingly.
Right. Getting better is priority number one.
Absolutely. Patients were very clear. Environmental concerns take a backseat when their health is on the line. Some even used words like egocentric or selfish to describe feeling that way, but they were honest about it.
That's understandable, though.
Totally. Someone with cancer said, their first thought is, how much will this help me with as few side effects as possible? Makes perfect sense.
Did they find any willingness for trade-offs?
Minor ones, maybe. Someone mentioned being okay with a reusable speculum, even if it was slightly less comfortable. But, and this is the key, only if their main health outcome wasn't compromised at all.
So health first, always.
Yeah.
Non-negotiable. Got it. Now, you mentioned something about a perception gap. That sounds intriguing.
Yeah, this was fascinating. The study found that patients tend to underestimate how open other patients are to talking about environmental issues in healthcare.
So I might think I'm interested, but assume other patients aren't.
Exactly. And the implication is If patients think that, maybe doctors and nurses also underestimate how receptive patients might be.
Ah, so they could lead to professionals being hesitant to even bring it up.
Precisely. It creates this potential barrier. The big question it raises is, how do we bridge that gap? How do we have these conversations appropriately, ethically, without making anyone feel pressured, especially vulnerable patients?
It's a really critical point, finding that balance. So, wrapping this up, what are the big implications here for healthcare's future?
Well, I think this deep dive shows that sustainability isn't just some abstract policy goal anymore. It's becoming, or has the potential to become, part of actual patient-centered care.
Hmm, like another dimension of quality care.
Maybe, yeah. The real challenge, but also maybe the opportunity, is figuring out how to weave this in personalized, sensitive ways, ways that empower patients with information, but always, always support their health and well-being first.
It definitely gives you something to think about, doesn't it?
Yeah.
Makes you wonder perhaps what aspects of your own healthcare journey you might start seeing through a slightly greener lens.